Hello. Welcome to Foia Fest, everyone. Thanks so much for attending our session here. So I'll just introduce everyone and then we can go into our conversation. I'm Krisen Schorsch. I cover public health and Cook County government at WBEZ Public Radio in Chicago. Caroline Chen is a reporter at ProPublica covering healthcare. We're all healthcare reporters here. Joe Mahr is an investigative reporter at the Chicago Tribune, specializes in healthcare. And Shalina Chatlani is a public radio reporter. What's your station again, Shalina?
I'm embedded at WWNO in New Orleans, local NPR, but it's part of the Gulf States Newsroom, which is the NPR stations in Louisiana, Alabama, and Mississippi.
Yep. Okay. Awesome. Okay. So I thought it would just be interesting to start with, before we kind of dive into stories we've worked on and talk about like strategy with FOIA, because we all work in different parts of the country. I just thought it'd be fun to start out with talking about how FOIA friendly it's been during the pandemic. We all talked about this a little bit yesterday, but Caroline, maybe we can start with you, like just in terms of like overall, kind of broadly speaking, how it's been using FOIA during your COVID coverage.
Yeah, we can talk about this more in detail, but I would generally say it really depends on the story. There are times where it's been faster and more effective for me to FOIA state health departments or at the state level before the federal level. There are other times though where, because the CDC or the FDA is the aggregator of data coming from the state level, they can also end up being faster. So I guess I would say there's no one hard and fast rule, unfortunately, but it is worth always thinking about every possible avenue you can FOIA and try them all.
Joe, what about you?
Yeah, it's probably the same thing. I know when this pandemic began, I'm not sure about other people, but when it initially began, there was that sense of, oh my God, everybody's overwhelmed. And I tried to be gentle with agencies initially, and say, listen, I don't want to FOIA, give you guys some time. I'll do all I can, and try to work with you. And some agencies were good like that, but other agencies I found just kind of got to their old ways, right? So eventually you're, a few weeks in, a month or two in, and you have to, I got a FOIA. I'm going to have to, right? And then it just became a process where with some agencies, you would never get a response, right? And you were just having to constantly hound them. Other agencies were pretty good, right? So I think it became kind of like it was before the pandemic, but probably with exclamation points.
Mm-hmm. Okay. Shalina, what about you?
Yeah, so in the South, the FOIA laws are definitely not very friendly towards journalists. It has been really difficult getting records, and a lot of the sunshine laws in my states are pretty outdated. And public health agencies, any government agency can really charge any amount of money for the labor that goes into a public records request. So you end up getting lots of invoices that are very, very expensive for records. I think the other difficult part about my states is that they are sort of chronically underfunded. Public agencies are chronically underfunded. So there just aren't that many people that are available to work on really large data requests. So that adds another layer of complexity. I felt like at the beginning of the pandemic, as a healthcare reporter, it was really difficult to get access to even basic things like demographic data, like who's getting COVID, which types of populations are disproportionately impacted. And while other states were more on top of that because they had the manpower and they had more funding, my states really weren't. So it added these extra layers of difficulty with reporting.
Yeah, interesting. Yeah, Joe and I are both in Chicago, and yeah, I mean, same thing, Joe. I found that some agencies who I think were just really used to working with reporters and we're used to FOIA, were obviously overwhelmed, but we're like, yeah, we're going to get to it. But I also found that agencies that I normally didn't have to FOIA were starting to ask for that. And maybe that was an organizational thing on their end, like maybe they needed that paper trail, so to speak, so that they could be organized too. There's definitely longer wait times, definitely a lot of back and forth about just, is this even going to happen? So that's interesting. And I just wanted to tell the audience here, feel free to drop questions in the chat. I think we'll have a conversation on the panel here, and then we'll leave a good amount of time for Q&A, and I'll be mindful of all the questions that people are dropping in here. So let's talk about some of the stories that you all have covered, because I think it'd be really helpful to kind of pick apart how you did them, like what the FOIA language was, what happened if you didn't get records, and in some cases, maybe you didn't even FOIA because that wasn't available. So Joe, let's talk about the story that you did in May of last year when the vaccines were coming out. You worked on this with two other colleagues at the Trib. You were trying to find out, who was actually getting a COVID vaccine, like down to which zip codes they came from. And your key question was, were people in the suburbs getting the supersized share of early scarce vax doses from the city? I'm going to drop a link to your story here. Can you briefly talk about how FOIA was involved in this? Like what kind of language did you use?
Sure.
How did you go about it? Just kind of helpful tips, I think that would be good for the audience.
Sure. Yeah. Well, the initial idea was that the city of Chicago proper got its own allotment of vaccine. And this was, of course, the Lord of the Flies era of the vaccine, right? When a lot of people wanted it, it was very scarce. And there was a lot of fear that people with money, power, clout would get their doses, and people who had less ability would kind of get left at the sidelines. So the key to that is trying to figure out, well, who's getting vaccinated. The states and the city were pretty good about putting out statistical data saying 500 people got vaccinated today, right? And they would sometimes break it down by race and age. But what we needed was very specific stuff to say, okay, so who got vaccinated in this zip code? And then what zip code were they from, right? Did they have to drive 2 hours to get a shot? Did they drive 2 hours into the city and take a shot that may have been meant for someone in the city? So that requires what's called raw data, where you can get the data that is individual for each shot. And of course, there are some rules about, you can't get like Bob Jones got a shot today, right? But there's ways to de-identify the data. So what I did is I went to the state, and then what I'll do is I'll drop a PowerPoint if people want to dive deeper in that there. But so what I did is I basically went to the state and I said, hey, state, can you get me raw data on all the shots? And I know that you can't give me everything, right? But can you download it in a way that I can't tell who got the shot, but I can tell these basic things about it, which zip code they were from, where they got the shot, that kind of stuff. And normally our state has to do that. You might want to check your FOIA. With data, it can get a little tricky. Some states will say, well, we don't want to create a whole new record for you. That's a whole lot of work, and we don't have to because the database that we've got has everybody's name in it. And if we have to give you one that doesn't, that's creating a new record, and we don't have to do that, right? In Illinois, there's case law that says, no. Public agencies have to do that. They have to strip out the stuff that they don't want to give you and give you the stuff they do. So that wasn't going to be a problem with Illinois. But the problem with Illinois was there was another law that was tucked in there that basically said, hey, for health data, the state doesn't have to give out raw stuff. And it's in the PowerPoint itself, if you guys want to dig into it. But that was the gist, and you're at a roadblock, right? So what we did is went to the CDC, the federal agency. And as Caroline mentioned, it's the aggregator, right? So our state reports above to the feds, and everyone's state reports above to the feds. And basically we asked for the same thing, but the trick with the feds and kind of what I'd recommend for people to do is we first figured out how they keep the data. So we were able to figure out online, basically almost their roadmap, their Bible of how they store it. And then we could basically say, hey, we know you guys keep it. We know you store it this way. Can you give it to us? And initially they gave us a little bit, and we said, no, seriously. We know you store it this way. Here's the actual stuff that you guys keep. Here's your instructions online about how to give us this data in a way that doesn't identify people. So seriously, you got to give it to us. And eventually they're like, oh, okay, we'll give it to you. And that took some time. It took a few months, but we ended up getting it and being able to do the story.
Okay. Yeah, I think that's a really important message here, is doing your homework, before you file a FOIA. Joe, we did a similar story at Be Easy about, and we couldn't, and this was like in March. And so your story was in May, in terms of trying to figure out who was getting the shots right. And yeah, the state and the city, Chicago Departments of Public Health and Illinois Department of Public Health, neither provided the administration data, right, of like the people, but we were able to get, after like 6 weeks of negotiations, data on the distribution, so we could find where the providers were actually, like, who was actually getting it at a provider level. But yeah, it was a lot of negotiation, and the only way that I knew that they definitely had that was because sources were telling me, like, we're asking for this data too. Providers were asking for this, and they knew it was all tracked in the state's vaccine registry. So right, so just like a message of part of the strategy of FOIA is to do your homework, really work with sources so that the agencies you're FOIAing can't say we don't have these records, because they exist. Shalina, you also worked, it feels like every single person in this country, right, who was covering healthcare was doing a very similar story. Everyone's trying to find out where the vaccines are going, because we knew who was getting sick and dying most, right? So you want to see, like, is this an equitable distribution? So Shalina, can you talk about like what it was like to cover this in the South, especially because you mentioned how you had to pay, you either had, did you end up paying, you didn't end up paying this money, right? Like, you had to negotiate down like this pretty big price tag for FOIA.
I never paid that money. I refused, because I didn't want to set a precedent that is something I would do, or that any newsroom should do. Pay, upwards of $3,000 for data that's owned by the public, right? Because at the end of the day, like, all of this data, right, it's owned by the public. And I, in my records request, that's something that I write, is that this data should be free, not only because I work personally for a publicly owned entity, that's what public media is, but also healthcare data, is important for the public to stay informed, like, especially during a pandemic, when decisions about where they could go one day could prevent them from getting COVID, or certain communities, transmission rates in a county, like that all that data is very important to the community, and so it should be publicly available. So I never paid that amount of money, because I thought that it would be counter to the intent of what FOIA laws were made in the first place for. But yeah, so I tried to do a similar story to what Joe was doing, where I saw that transmission rates were particularly high among low-income communities of color in the South. That was the trend that I was seeing in the South. We saw it in places like New Orleans. Right after Mardi Gras, we saw that low-income Black communities in particular were disproportionately impacted by COVID cases. And so what I was wondering, as the vaccine was starting to be rolled out, was whether the state governments in the South were putting vaccine in places that were actually accessible to those communities. So is it a question of whether those communities are hesitant about taking the vaccine, because that was the discussion that came up a lot, or do they simply not have access to the vaccine? And so I was looking for how are state governments allocating the shots that they're giving? Are they sending them to hospitals in urban areas where there's predominantly wealthier white communities, or are they sending them to the safety net institutions where those low-income communities of color are located? That seemed like a very simple story idea that ended up being very, very challenging for reasons that I still don't quite understand. The health departments were simply not keeping that data very well. They weren't really tracking as much, like how much, vaccine were they allocating to specific provider sites. I was very interested in federally qualified health centers, and had heard anecdotally that a lot of those FQHCs, which predominantly serve Medicaid populations, were not being given an equitable share of the vaccine. So in trying to get that data, I sent in a FOIA request several times that was modified several times to health departments in Mississippi, Louisiana, and Alabama. And in particular, in Mississippi and Alabama, it was a real big fight. In Mississippi, the first set of data that I asked for was, how much vaccine have you allocated to every institution, divided by hospitals, FQHCs, like these different provider types. and how much has actually been given to a particular demographic group. And the first price tag that came up on that request, which on its face seems pretty simple, right? Like health departments should be tracking this anyway. It was $3,000, an invoice for just that. And this was pretty early on. So that was only, about 3-4 months worth of data, which wasn't that much to parse through. So my next step was to get on a phone call with the press officer at the Mississippi Department of Health, because I wanted to collaborate instead of being combative. So I asked, how can I modify these FOIA requests so that it's not an undue burden on your understaffed agency? And I get exactly what I'm looking for. And after all those several processes of reforming, revising, of going through phone calls, of talking about how to specifically get what I needed, the price tag only dropped to $1,500. So, and then
still a lot of money.
It's still quite a bit, yeah. Nothing that I'm really willing to pay for something, again, that's publicly owned. Next door in Alabama, consulted with lawyers at NPR about like, how do I format this? Consulted with local FOIA lawyers. How do I write this FOIA to apply to Alabama law? Even had a phone call about what type of vaccine tracker system do you use so that I can specifically grab this particular data based off of your database for tracking vaccine allocation. After all of that, they came back and said, a public health emergency is broadly defined, and under that broad definition, we don't have to respond to your FOIA request because we don't have time or capacity. So, so it's a little bit of a different process than what Joe went through, because, you were ultimately able to get something, right, from the CDC. You were ultimately able to get something from your state government. And I knew that at a certain point, that wasn't going to work. So I, shifted to just on the ground reporting, like getting people on the record who are close to the issue to say that the things that I was thinking were happening were happening. And, that was the way that the story got told, which was that there was a community health center that had existed for a very long time that was serving a key population in Mississippi that said they were not getting vaccine, that they weren't able to vaccinate their populations. And, that's kind of how the story, unfolded. And I realized that my relationship going forward with those health departments had to be one of more like sort of being nice and trying to develop a relationship so they might feel more comfortable giving me things in the future. And so that's kind of how it's worked out. And now I don't really even submit FOIA requests. I just ask for things and try to be as, I understand that you're understaffed. I understand that these things are difficult. Do you think you could spare some time for a phone call? So I've realized that that's kind of the strategy that might work more in a place like Mississippi or Alabama, which might not be as receptive to a FOIA request. Yeah. So a very different story than Joe's.
Yeah, I think that's important for people to realize too, is there's a lot you can FOIA and there's a lot that you can't FOIA that's not accessible, especially when it comes to healthcare. But yeah, there's also a lot of records you don't necessarily need to FOIA. Like maybe you have a relationship with an agency and you just say, hey, can you send me X, Y, and Z? And they'll just, like, there are plenty of agencies in Illinois that'll do that, right? They know that this is a public record anyways. So why are you having to file a FOIA request that can take 5 days to get a response and then ask for an extension? By that time it's 2 weeks in when they could just give it to you. So I think that's important. Caroline, you talk about, you have a different strategy. So at ProPublica, you're often looking at things, obviously national scope, but when you were doing this particular story involving the CDC, you ended up not waiting for the CDC to get back to you because you knew it would take a really long time. So you actually FOIA'd states. Can you talk about that story, like what your technique was and how that came about?
Yeah, so in late February 2020, long time ago now, I had written this story. So it's not the one that Kristen's linked to here. This is sort of what led us to the story that Kristen linked.
The test one here?
Yeah, so there was a story we wrote about the CDC having made some decisions that delayed the availability of tests. So that was end of February, and that came from like normal human sources. There was no FOIA involved there. I mean, there was actually some very technical scientific documentation that was freely available on the public, on the CDC's website that helped me write that story. But after we finished that, we were like, wow, there's like something really wrong that happened here, and we want to get a sense of why and what happened there. So basically the day after the story published, we like sat down and talked about what our FOIA strategy would be. And we knew we wanted to get a sense of what was going on in the agency around these tests. But we also knew that it would probably take a really long time to get back, particularly if you're ever FOIAing for emails. That is usually like the slowest FOIA request, and the one that they're most likely to drag their feet on because they have to redact it and all that sort of thing. So I guess the general tip would be, if you're FOIAing for emails, try to make it as narrow as possible and as specific as possible, both in terms of what you're asking for and sort of the time frame. But we thought we might as well we knew at that point in time that the only tests that were available were being sent to public labs at the state level. And so we thought, well, we should basically FOIA both ends of this conversation. And we sent a bunch of FOIAs to a select number of both cities and states. Partly that was how we picked those was based off of reporting and this plan that the CDC had at that point in time to like do like pilot surveillance, and it never really materialized. But anyways, that's how we picked the states. We didn't quite do all 50 states. And the request, I'm just looking at it, kind of went along the lines of copies of email communications. And then we try to find the specific division. That also usually helps. So like we found out that a lot of state departments have like an Office of Emergency Management that would have been sort of closely in this, or specific labs. So being able to go to a department and say like, we want it between this subdivision can also help narrow your request. And then we said, communications between whatever the department was and any email addresses with the domain name at cdc.gov, at cdc.hhs.gov, or at fda.gov that had a list of terms. And then we try to put as narrow as possible a time window on that. And then Nevada got back to us first, and that led to the story that Kristen put in the chat. And I think one of the things where we actually just frankly got lucky on was that Nevada was included in a lot of emails to the LAX region. So we actually got a lot of insight into what was going on around airports, which we didn't necessarily expect to come out of that state, but we did get lucky there.
How did you use the airport information?
Because this was all about, the initial strategy was to try to stop travelers. So you could kind of see that sort of back and forth happening in those emails.
Interesting. Okay. Let's talk a little bit about just, more on like strategy. So how much do you all, like when you're doing your homework before you file a FOIA, how much homework are you doing? Are you mostly working sources? Are you hearing about things? So you just kind of file more of a blanket FOIA? Talk a little bit about like each of your methods a bit. Shalina, you want to start?
Sure. I think I definitely start with a lot of background work first, talking to sources about what they're hearing, any hunches that they might have, what they're seeing. Now, a lot of the times what I do is I'll look at trends. The CDC actually has, ample data now on, staffing, for example, at hospitals. Which hospitals are like close to having no staff left, or, where is transmission really high? And when you look at that data that is already publicly available and see trends, I think it like sort of gives you a clue as to other story ideas that you might want to submit records requests for. That was something I did with a story that I did for NPR recently, where I was seeing that, there was a staffing shortage that was happening, and I was wondering how hospitals were filling the gap. And the more you dig in, you see like they're getting travel nurses, and you see more reporting travel nurses are getting paid thousands of dollars a week. How are they getting this money? How are these underfunded hospitals getting this money? And the more you dug in, you saw that FEMA was supplying a lot of the money that was ending up going to travel nurses. And then I was like, okay, how much money has FEMA spent on travel nurses? So all of that like got me to that question. And that's when I started asking states, submitting records requests. Tell me how much money has you've spent on invoices for travel nurses? You get to that specific question. So I definitely do a lot of background work before submitting a records request, because the more specific you are, especially in my states, which are understaffed and underfunded, the easier it is for you to get exactly the answer that you want. And, in the case of that story, I wanted everything. I wanted the invoices. I wanted to know which travel nurse agencies were you, spending the money on? Who was it? And I kind of had to just settle with, tell me how much you've spent to get the story out, it needed to be, one specific thing. But I will say in other instances, if I feel like there's something broader that could be happening, I just write those FOIAs and I start submitting it. Because I know down the line, after I do the first story, something may come out of the FOIA that I submitted early on. So I do think there's ways to be specific and intentional for the first story, but also have something kind of bubbling in the background.
Yeah. So what about you?
Yeah, it's pretty much all those things, where you try to work sources, you try to Google, you try to figure out how they keep the records. But some of the tips and tricks I've learned over the years, if you're having trouble trying to figure this out, if you're hitting a stone, a brick wall or whatever, a lot of times I'll try to think like someone who works in that agency. I'll think like a boss. I'll think like an administrator, and think how would they do their job, And sometimes I'll ask them that if I'm able to get them on the phone. How do you do your job? Like if your job is to manage widgets, like how do you do it? Do you just kind of just look to the heavens to hope your employees are doing their job? Do they have to file reports every once in a while, to show they're doing things? Do you run reports? A lot of times they use the term run report, which is code for like you can get a memo or a spreadsheet or something. So how do you do your job? How the heck are you making sure things are running smooth? And a lot of times if you pivot to that, oh, well, we do our job. We keep all sorts of stuff. We keep records. We have periodic reports. We have all these kinds of things, right? You can find things to FOIA that way. Kind of along those lines, if you're running into a roadblock at an agency, you can FOIA their policies and procedures. So this is what their employees are supposed to do to make sure things work, right? So if I'm a clerk somewhere, I may have to type in, you must go to this certain database, the Onyx database, and type in these things and, whatever, right? And all of a sudden in policies and procedures, when they write those, they're not writing them to try to keep things secret from you, right? They're writing them to try to inform their employees about how the system works. So sometimes you can glam onto those. Those are public. They can't not give you those. Then you can say, oh, you guys have a system called Onyx? How does that work? Oh, you've got this. Oh, you've got that. And sometimes some states also have parts carved in their law. Illinois has one where you can ask an agency for the basic categories of the records they keep. This is this can be tough to get in practice. Agencies will sometimes balk, but you can point to the part of the law. Illinois has one for data as well. You can say, well, how do you keep it? Tell me what you've got. And sometimes if you do enough of these probing in different areas, you can get them to basically tell you, okay, we have reports. We do them every 3 months. Okay, we've got this. I'll stop blabbing, but another tip too that I'll get from sources is I might say, oh, did they send you a form? Did they send you something? And then you look at that form, you say, hey, can you just email to me or text it to me? And you look at that form and on the bottom, it might read like, created with this spreadsheet or created with this system, and there might be different spots on the form, fill out this, fill out that, fill out this, fill out that. And then I'll know, because I do mostly data now, I'm like, okay, well, they must have a database that records this, right? This isn't the 1950s, right? So they're asked, why are you asking somebody for this info if you're not recording it somewhere? And then I can go back to an agency and say, I'm assuming you have these fields and these fields and these fields and these fields because you have a form that asks for it, right? So a lot of times it's kind of putting agencies on the defensive to prove they're doing their job. And I think they'd rather prove they're doing their job and give you data when sometimes their initial stance when you ask for stuff is like, what do you mean? What do you mean records? We don't, what record? We don't have that, or we don't do it this way or whatever. So
yeah. Well, also it's like you have to find the person who knows, like, especially when you want data. Not every person who's in charge of communications at an agency, no fault of their own, maybe doesn't know all the things that they have and how it's kept. So it's good to, ask a spokesperson sometimes if you can have a background conversation with like the person who handles all their data, because that person will know the language of the FOIA. And also, you can FOIA manuals, which I haven't done before, but I have a colleague who FOIAs manuals a lot, just to understand, programming and whatnot. Caroline, what about you? Oh, go ahead, Joe. I'm sorry.
Yes, I don't want to give the impression that every agency is like this. Many agencies are different to work with, but every once in a while you're going to run into an agency that just wants to stonewall you. Right. And these are tips that I use.
No,
I'm not going to repeat everything that's been said because it's been so good. I put a link in there, which is, like as Joe was saying, like understand how they store their data, like what kind of data is generated. This is something that led to a story that a colleague of mine did. So this is a records control schedule of things that agencies have to send to the National Archives. So it's not going to be complete for like everything an agency produces, but it does give you a remarkable insight, because a lot of them, if you click into like a specific, let's say this is my colleague works, Annie Waldman, covers education, and she went to the DOE's agency, and she found, a lot of information about how they keep certain types of case reports, and like that lets you be, again, more specific in your FOIA request. They can't be like, this record doesn't exist. You can point to this and be like, hey, we know you collect this record. In fact, we know you collect it because you have to send it to the National Archives. So it's not like you create it and then immediately burn it. It has to stick around for X amount of time. And that just sort of gets you through some hoops. To what Kristen was saying, I do think that, yes, I am often pushing to talk to the person who's actually handling the data. And some agencies are very reluctant to get you past the PR person, but then sometimes you just start asking so many very technical questions that they kind of get overwhelmed by, and they're like, all right, I'll just put you in touch with the person. And you're like, it doesn't have to be on the record. We just want to talk on background. It'll help me understand how you've organized this. And one good example of this, when the CDC originally started reporting vaccination data to their, to their dashboard, there was like all this stuff in the like fine print under it that we were like, we do not understand like how you were exactly counting doses and things. And we had all these like very detailed questions, and my colleague kept asking them for this information, and simultaneously what helped was other reporters at other newsrooms were also asking the same questions. And I think we just like collectively overwhelmed the poor spokesperson trying to handle us. And they were like, we're doing a background call for all you data reporters who want to understand what's going on in the system. We're like, yeah, this is like so basic. We just want to understand where you're getting the numbers that you put up here, So sometimes it helps to have pressure coming from multiple angles to get that sort of basic information.
Yeah. I would also say a lot of times, like say you're doing a story or you're hearing from sources that these big things are happening, and you start asking around and you realize nobody's tracking this data. Turn that into a story. I was hearing from a lot of sources that early on in the pandemic that a lot of the safety nets were very overwhelmed with patients, because safety net hospitals are typically in low-income communities. They have very small ICUs. So you imagine when COVID first happened, you have a hospital with a 10, 12 bed ICU versus a big academic medical center that has, 50, 100 plus beds. What happens if a small hospital gets overwhelmed? Where do those patients go? So when I couldn't FOIA this because nobody tracks hospital transfers, I basically built my own database by requesting the same exact information from tons of hospitals in the city and suburbs, and then called them out on it. Basically said, like, you don't track this. This is a huge problem. Like, where's the solution? This is still a problem. Joe and a colleague of his, Lisa, at the Tribune recently wrote about this too. So I suggest maybe you guys do this in your communities, because I think maybe Omicron is receded for now, but I don't see this issue going away. Let's talk a little bit about how to stay organized. We talked a little bit about this yesterday. You think about filing lots of FOIAs, whether you file a couple a month or you file, 100 for a big story. How do you all stay organized?
I can
Shalina?
take a stab at that first. Yeah, I think the first thing I would say is that everybody's organization system is different. And so you might hear things that one of us say that you're like, I could not do that. And like that, I think you should listen to your instinct and work with how your brain processes this sort of stuff best. So I tend to use spreadsheets. So I just will have if I'm working on a specific project, I'll have a spreadsheet that is the FOIA log for that project. And I'll keep track, what date it was sent to what agency, what was the name of it, what's the current status, like what, I heard back, they rejected the expedited, and I appealed that, like that might go in there. And I'm pretty good at checking in on my spreadsheet to make sure that I haven't forgotten something. I have a colleague who works totally the other way around, never uses a spreadsheet and just sends himself email reminders to take action, to take the next action or to follow up. I think that would drive me crazy. So I think it is up to you, but I guess the main thing is that you don't want to lose a FOIA that you've done and come back to it 6 months later and be like, oh yeah, like what happened to that? And then realize you've missed a lot of opportunities to be pushing the agency to actually respond on time.
Well, because also legally they don't have to then provide it because the window is up.
Yeah.
Right. Joe, what about you? How do you stay organized? You work with tons of data, so I'm about this.
This is where I'm just sitting getting advice because I'm the worst at organization. So when I'm at my best, I'll keep spreadsheets and I'll put reminders and all that kind of stuff to check up on things. But this is where I need work. That's I'm more aspirational when I give this advice than actually like practicing it. But all that's been talked about, the spreadsheets are great. Google Docs if you're working with other people, because then you can each kind of keep an eye on what's going on. I will put reminders. I'll even do the old-fashioned yellow pad. A lot of times that's what I'll do is I'll put a yellow pad with a little thing around it being like, okay, next week, check on this. Because sometimes just the act of writing it kind of gets it embedded in my head. But yeah, I'm not great at this.
Mm-hmm. Shalina?
I'm definitely still learning too. The pandemic means that, especially as a healthcare reporter, means that you have a bunch of different stories cooking at the same time. I definitely have some analog things like a whiteboard with a marker that I'll be like, okay, this story, I filed this FOIA, I need to check in by Monday. Let me see when I get the thing back. So like I see it when I'm working.
That's cool. You have a whiteboard.
Yeah. Very like college vibes there, right? So I do that because it's sometimes I need like a visual reminder of, okay, this story is in progress, this story is finishing, here's what I need to do and an update on that one. Another thing that I've done recently is when I'm working on a big investigation or a long-term thing, I will put the documents into a Google Drive folder and keep them all sort of like there. Download like whatever spreadsheets, turn it into a PDF format, whatever it might be, and just put it in Google Drive. And then as I'm keeping track of things that are going on, I'll write like a research paper almost in a memo format, and then I'll footnote every fact and where I got it and link it to the actual document so that I know that when I have to go back and actually write the story and I'm pulling out a fact, I have the document that I got it from. So that's another way I try to keep track of like all the things that I've gotten and why it's important. Also try to keep folders in my email based on topic. So if I'm getting a lot of emails in on an issue, I'll try to move those emails to a specific topic folder so that if I need to go back and search for those emails, that they're already kind of like in a place based on the story. But yeah, definitely trying to get better at organization too. But those are some things that have helped.
That's organized though, to actually create folders in your email. That's organized. I have just a general spreadsheet for all the FOIAs I file so I can keep track of who owes me what. And then I have all of my stories and folders on my desktop. I will say, especially for people who are in the audio world, you're constantly writing basically two different stories because you've got your digital or print story, and then you've got your audio story, and they can end up being very different. So for audio, especially, you got to keep all your tape organized. And like Shalina mentioned, I mean, sometimes if I'm working on a big long-term story and I come back from an interview, I'm going to have to go through hours and hours of tape. I'll come back and try to go through that tape already. I do a lot of Otter transcripts too, and I will transcribe that tape and put the just Otter link within the folder with my tape. And then I try and actually go through the tape so that I'm not later going through like 30 hours. Because it just takes that much more time to do an audio investigation on top of the digital story you're also going to write. So we have about 10 minutes left, so I thought I would circle back to some of the questions that we had in the chat. And so everyone, please feel free to drop more, but there were two at the top. This one we might have gone over a little bit already just with this conversation, but maybe we have more tips here. This is from a beginning Foia. Do you need to know before you Foia that the type of information you're looking for exists before you Foia? So we already talked about this a little bit, but what does anyone want to take a stab at? You don't necessarily need to know that information exists, but it obviously really helps to know so no one can deny you.
Yeah, that's the thing is you can put a broad FOIA out, so you don't have to know it, but it helps. But if you do that, you should. When I do that, I probably know that okay, I'm probably going to get some weird answer back, right? And so it's either going to be and this is a longer answer than anybody's asked for, so my apologies. But there's two kinds of states. There are states that will tell you it's too hard to do something, so go away. And there's states that'll tell you, well, we have to do it, but we're going to charge you this unseemly amount. So Illinois is like the first state. So sometimes you have to ask 2 or 3 or 4 times to get, and okay, well, we don't have this, but we have this. For other states, I've worked in Missouri, and it sounds like with Shalina in the South, a lot of them, there's states that they have to do stuff, but they're going to say, well, to do this much, it's going to cost so much money. And then you have to argue or you have to winnow down the window of what you want. So the short answer is no, you don't need to know it, but it might take you a little longer to get stuff.
Okay.
Or a lot longer. One other thing I just wanted to mention here is you might know that it's helpful to know how an agency handles its FOIA requests. So, for example, at the FDA, they have a simple queue and a complex queue. And, depending on which your FOIA falls into, it's either going to be handled pretty quickly or it's going to take forever. So, but there are nuances to that. Like if you are getting adverse events reports from this spreadsheet, this database that they have where doctors report in adverse events that patients experience related to a drug. So that information's there. You can literally see the charts in front of your eyes, but you wanted to get the incident reports under that. Like at one point, I think a FOIA officer there told me that if you ask for fewer than 12, it goes in the simple queue. But if you ask for 13 and up, then it's like the complex queue, which is such a dumb, how would anybody know that? But once I knew that, I would put it in, I'd ask for 12, I'd get them back, I'd have my next request ready to go, and getting them in
can
those.
You just ask, make separate requests for 12, 12, 12?
They will catch on, but it is faster to be here's 12. They actually respond very quickly because those are already kind of pre-redacted. There's not a lot of redaction for them to do, but I just need to be in that queue for them to handle it quickly. And then once I get those back, I send the next 12, and then I get it back and I send the next 12. And it is way faster than if I sent a request for 36 in one go. I would hear back in 2 years. How would you know that? This is where you need to understand the process.
Yeah. Okay. Awesome. Thank you. Here's another question that says, this reporter is looking for advice. I've been trying to FOIA a city that has mandated all employees to be vaccinated or undergo weekly testing. The city won't give me the percentage of staff that is vaccinated. What language could I use to get that information that doesn't violate HIPAA?
Yeah, I mean, if it were me, I would ask for any periodic reports or statistical reports or any memos, that that discuss or denote vaccination rates among employees. It's something like that, right? Because in theory, somebody's telling somebody else what the vaccination rates are. There's going to be different sets of records. There's going to be the core set of records where you may list every employee's vaccination status, and you can't really get that, right? You could fight for it and try to get it de-identified, but might be a hassle. But in theory, somebody cares about this. So someone is taking a look at this data and typing up a memo or an email or a report that maybe comes out every week or so that says, okay, 25% of our employees are vaccinated, 30% of our employees are vaccinated, or by this department. So I would go for that next level, try to get that.
I also think it'd be interesting if they won't give it to you. I don't see why they wouldn't give you numbers. You just, you're not trying to violate HIPAA. You're not asking for people's names. But if they ultimately still won't give it to you, you could write a story saying that the public doesn't know who is working for the government in terms of like what their job is, right? So you think of the really public facing jobs when you work in government. Does the public deserve to understand on an aggregate level what that vaccination rate is? We've seen in Chicago that, the mayor is requiring city employees to be vaccinated, and they have been transparent about the rates per department. So you could just see percentages. They're not giving people's names out, but you have a clear understanding of like in HR versus police versus fire department, what those rates are, which I think is interesting. Dawn Rhodes, hey Dawn, has a question. It says, I'd love any tips you have about familiarizing ourselves with HIPAA, understanding what kind of information is and isn't FOIAble, so we're prepared in case a FOIA officer cites HIPAA as the basis to deny a request.
I can try to tackle that one. I think even in the last case, and similar kind of advice here, I would just straight up ask the official, like, can you just give me the vaccination rate? Like, they should have that, like they're tracking it. And if they don't do that, I would have a conversation. I would say, can we get on a call with whoever is in charge of that information, keeping track of that information, about what is going into keeping that information, like Joe talked about. And same thing here. I have done this before where I've said, I'm doing this particular story and I want this type of information. And someone has come back and said, well, some information is protected. So I say, well, can we hop on a call and talk about what type of information I am allowed to get? And usually I think, maybe they may not want to talk about those things, but you're still asking them to have an interview about it. So, they can say, these are the types of data that we keep track of. This is the type of format. Sometimes I ask, do you have a database where you keep this information? What are the headers in the columns? Like, can you give me a copy of this spreadsheet where the column with the names are taken out? So I think this is the type of case where if someone is coming back to you, you ask them to have that conversation so you can figure out what information to exclude in your FOIA request.
Yeah. And I think also anytime someone just throws up HIPAA, they need to cite specifically what part of the law is prohibiting you from getting that information. If you ask for de-identified data, you are explicit in your FOIA, like, I don't want patient names. I'm not looking to identify people. You're looking for numbers and other records. I'd be really interested to see how they're coming up against that. Also, if they still won't give you those records, I would find a FOIA attorney. There are lots of really generous FOIA attorneys out there who know the law like the back of their hand and know exactly what you can and can't get. So Dawn, I don't know if you have something particular in mind, but I rarely get HIPAA as an excuse to not give me something. It's usually a law that prohibits, the revealing of some sort of healthcare information that hospitals don't want disclosed, and state law protects it, for example. So yeah. Any more?
I just
Caroline,
wanted to add, I'm putting in 2 tip sheets that are from AHCJ that Dawn might find helpful with just familiarizing yourself with HIPAA. So it goes over HIPAA. And then the second one is sort of more specific to FOIA. But yeah, generally I would say there's this reflexive, HIPAA. And then when you really poke, the answer is usually like, oh yeah, doesn't violate HIPAA. So I would not stop with that denial. And I agree. The other thing this is sort of a broader suggestion, is it sometimes helps to look at other states, especially surrounding states or states that are pretty similar nearby. During the pandemic, I feel like that has been one way that a lot of reporters have managed to push their states to release more information. So very early on, I remember a number of states were like, we can't provide demographic information about who's getting COVID because I don't know if they even said HIPAA, but it was some sort of like privacy argument. And then reporters were able to be like, well, the next state is, breaking down who's getting COVID by race and gender. So why can't you? And so I think that is often helpful, or even more in more detail, to be able to say like, oh, like this other state that's more transparent, I can see how they keep that record. And they'll give you a sense that like, maybe this is sort of roughly how it would be structured in other states, and being able to take that and be like, hey, the next state has this sort of database. Do you have an equivalent? And going back to what Joe said, they don't want to look like they're not doing work, right? Because then that's a story for you. But it can be a jumping off point for you to say, do you have something that looks like this?
Yeah. Shalina, did you want to go ahead?
Yeah, just one other thing about that. I would also look to see if there's a version of that data, some type of version of that data that's already been reported, because that's definitely happened to me before with the Alabama Department of Health, where I've asked, like the story was how many vaccine doses have been wasted in the state. And I saw that there was a number earlier that had been reported. They came to me and said, we can't provide that information to you. And that's when you're like, really? Because I saw that you already did provide that information. And then 2 minutes later, they sent me an email with the information. So I think another thing you can do if people are coming at you with like things like HIPAA violations, because simply maybe they just don't want to admit something or they don't want to reveal something, it's really helpful to have that kind of in your arsenal, like, hey, I already kind of saw that you said this, so you need to give me an updated version of something that you've already exposed.
Yeah. What's Don saying? I didn't have a specific example. Always wary of FOIA officers reflexively citing it. Yeah. I don't know. I think it's a case by case basis. I mean, I think it just depends. Like if you had a specific story in mind, but yeah, I definitely wouldn't just give up because they cite HIPAA, because I'd be like, why? What is so violating HIPAA? Especially if you're not asking for patient names. Also, if it does involve a patient, you could have the patient get their own records for you, and that way you could use that in a story. I know a lot of reporters do that. I know some reporters who have people like patients sign like HIPAA consent forms just to cover all the bases. But I find that, like, for example, one time I was FOIAing autopsy reports, and I was able to get, so much of a record, but the family was able to get more information. They made their own request. So there's ways to go around it, but I definitely wouldn't give up. Joe, did you want to add something?
Yeah, well, first I'm going to say, Caroline, love the cat. You got to pet that cat. She's just jumped off. Oh, I just want to reach out there.
Sorry. I love the light.
Great. And that's going to just something that Shalina said made me think of another tip, which is, and she had mentioned how sometimes agencies will have to, will already have things reported out. And one thing, this applies to healthcare, but everything, is that sometimes your agencies have to make reports to other agencies. They're not all, sometimes there's parents, right? They're the kid, they're treated like a kid by another agency. Maybe they've got a report on a grant they got, and they've got to tell the feds something, like with vaccination data. So I would look for those situations where if you've got an agency that's not giving you information, and see if there's anywhere that it has to report to somebody else. Because when it has to report to somebody else, hopefully it's not going to try to BS them or try to minimize the problem or whatever. It's probably going to say, yeah, here's the deal, right? And the other agency who knows a lot is probably going to insist that they don't BS them, that they basically are honest with them. And I think probably the one who fills it out hopes that no one ever asks for that record, because then they're going to look silly. Yeah. So that's another tip.
Yeah. Well, guys, we went over our time a little bit. We could talk about this stuff all day. We didn't even get to like emails and all that stuff. But thank you all so much. Thank you, panel, for your time. This was so helpful. And to everyone who attended, I hope that was helpful. Do you guys want to each drop your email in the chat, just in case people want to follow up? Very cool. All right. Thanks, everyone. Have a great rest of your Foia Fest. Take care.